The Namibia Institute of Pathology's capacity was tested to the limit following the outbreak of COVID-19, especially to what was to follow when Namibia reported its first case in 2020. Majority of the population, not to mention the dependence on its services, faced with an urgent call to action, necessitated swift implementation of testing protocols while prioritizing the safety of its teams. Chief Strategy and Business Development Officer at NIP, Nita Evaristus, shared insights on the institution's experience during the pandemic.
COVID-19, NIP really had to act fast in the sense that we need to implement robust testing protocols and most importantly also to ensure the safety of our team and that of the patients. So really our team's dedication to responding to the pandemic nationally was truly inspiring, and they really worked tirelessly to process high volumes of COVID-19 tests. Mind you, at the time, rather at the beginning, NIP was the only laboratory that was performing COVID-19 testing. So at the time it was only done in Windhoek, but as time went by and with the support of various stakeholders, NIP was able to expand testing capacity to 6 strategic locations across the country.
NIP boasts a test menu comprising over 1,000 laboratory tests with an annual performance of approximately 3 million tests. The institute serves 82% of the population and operates 36 laboratories spread across all 14 regions. It provides services to 31 district hospitals as well as over 400 public healthcare centers, which makes NIP the largest pathology service provider in the country.
Indeed, it was quite a topical matter. And firstly, it is important to note that for optimal patient care management, a reliable specimen transportation system is very critical, or rather crucial. So prior to the acquisition of these vehicles, there was an assessment conducted into the specimen transportation logistics. So definitely the need for improved transportation infrastructure is there, so that really NIP is able to ensure the timely and safe delivery of specimens to our laboratories. And of course then hence the investment into the 18 vehicles. And in fact, last year NIP employed 10 drivers, and this was supported by CDC Namibia, so that we just really increase the capacity. And maybe while we are at it, if I can take this opportunity really to clarify that the 18 vehicles that were procured are not limited to the NP200 Nissan Bakis, but rather include other models. We have the Toyota single cab, double cabs, and sedans. So really the investment of 11 million into this 18 vehicles includes but not limited to firstly vehicle costs, finance costs, repair and maintenance, as well as the vehicle tracking system. So in a nutshell, really, thus the acquisition of these vehicles are aimed to improve the efficiency of our specimen transport operations.
NIP recently acquired 18 vehicles to enhance its service delivery capability of samples. Evaristus emphasized the importance of maintaining relevance in their operations.